Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by Caleb Speyrer of an organization that I'm really fond of. Caleb, please introduce yourself, who you work for, and what your current role is.
Yep. So my name is Caleb Speyrer. I'm from South Louisiana. A little about me. I practiced for 5 years as an occupational therapist, during which time I got my master's in healthcare administration with a concentration in health system management from GMU, and used the administrative fellowship to kind of springboard me from clinician to administrator, and landed at HOPCo, and it's been uh, a blessing.
Thank you so much for coming on. I love the people at HOPCo. I've been meeting quite a few of them, and it's interesting because they have this great fellowship program, but they're not a kind of what people would traditionally think, where they usually get a fellowship at a hospital or at kind of a larger academic institution. They're a bit different, which is really cool. They have some great opportunities. And then, of course, your resume is so interesting because of that occupational therapy background, right? That's a unique background. You have a bachelor's in exercise science, and then you got, of course, the master's in occupational therapy. What was the kind of start of wanting to go into occupational therapy? How did that come about for you?
Oh yeah. So I'm from South Louisiana. A little bit about Cajun culture, other than talking funny and cooking well. We're kind, and we're community based, and we give the shirt off our back to help the person next to us if they needed it. And so naturally, that kind of aligned very well with going into healthcare. I didn't know what role that wanted to be, but I found the therapy role nice because I could kind of help people change their habits, roles, routines, and rituals, the thing that led to them having a complaint in the first place. So that's why I became an occupational therapist.
And then why did you end up going into healthcare administration, right? You spent time practicing, the occupational therapy. So what kind of wanted you to go towards that administrative route?
Yeah. So I got into occupational therapy at a hospital in Mississippi. That was where I got my first job. And I think I went in kind of green, if you will. I was blind to a lot of things. There were things that I didn't expect. We kind of romanticize healthcare going in, and we think it's going to be all pretty and clean, and we get to help and save people. And to some extent, we do, but there were things I was just not prepared for, like the amount of alarms that take place in an ICU that are ignored, or the amount of times I had to fight for a patient to get discharged to the appropriate environment or to get the resources they need and their hands were tied, or the fact that by the time someone reached me at the hospital, a lot of what their outcome was going to be is rooted in, what happened before they got there. So, in order to kind of expand my reach and to expand my capacity to help people achieve good health and well-being and quality of life, I felt like I needed to make a move where I could have a more broad impact. And I did the math as a clinician. I think over 5 years, I probably helped around 5,000 patients and families, and that's excellent. It really is. I'm very proud of that. That's why I got into it. But I've only been a fellow for 2 months, and there's one project I work on that is going to go live system wide uh, on our analytics platform, and it's going to give people better insights into clinical KPIs, quality, operations, and finance, and in turn help those health systems to perform better. And that just impacted the care of about 33 million lives. So uh, it's a much broader reach in administration, and that's what I was shooting for. And I got nothing short of that with HOPCo.
That is awesome. Yeah, congratulations too on being able to make that transition. Were you worried at all or nervous when you decided to go back for a second master's and start transitioning the career?
Yeah, definitely. One, I had to find a program that kind of fit my needs and aligned with my goals. Uh, I felt the need to get a degree from an accredited institution, but I also needed the flexibility to continue working full time because, I mean, life is expensive, right? Nothing comes free, and so I had to work full time. So George Mason fit that perfectly. I was able to work full time, pursue my master's in the evenings and on weekends. Took me about 2.5 years, but managed to get it. And that was definitely scary. And then it was also scary to think that, I get this degree and maybe I don't land a job. Uh, I like to think of healthcare administration, kind of like driving a Ferrari, right? Like you
Yeah.
wouldn't just let anyone drive your Ferrari. You want someone with a proven track record who's going to be safe and knows what they're doing. Same with healthcare administration. They wouldn't want someone running a service line or managing a group of employees with no experience. So how do you get that? And so I felt like an administrative fellowship would be a catalyst for me to get that experience and kind of drive the Ferrari with the training wheels on, or maybe that little driver's ed steering wheel. Uh,
I appreciate that because that is a big challenge, right? Like it's without experience in doing something, how do people know that you actually know how to do it, and how do you actually know how to do it? And one of the kind of questions I have for you, since you were, you know, through how many months now? 4 or 5 months, right?
No, we actually just crossed month 3, started June 24th. So
Okay.
just a hair over 3 months.
So 3 months in, do you feel like you've already learned a lot?
Oh yeah.
Yeah.
In school, you get a broad overview of KPIs. You get a broad overview of these different departments and different health systems and like payer arrangements and finances, managerial accounting. Uh, and that's all great, but you don't really get to see what the health system or what the physician's office or what the payer finds is really important, what they're trying to drill into to make change. And so, if anything, this reemphasized what I learned and helped me to highlight kind of the most important areas. It kind of pruned my focus to where I could see what was important and what was kind of noise.
Absolutely. No, that makes a lot of sense. And then, just looking at the resume here as well, you have an impressive resume. You've done a lot of great things. I want to ask, you know, how did you come to kind of learn about a fellowship or an MHA as a potential option? What led you to discover those options? Was it through networking or just something that you already had known?
Uh, I think that really came from being in the health system, seeing who was in charge, seeing what their backgrounds and credentials were, kind of networking, meeting with people in different healthcare roles, and learning kind of their road to being an administrator. And I tried to emulate that as best I could. So that's kind of
Right.
where I landed on MHA. I kind of went back and forth between MBA and MHA, but I really liked the focus on healthcare administration, so I chose MHA.
And then I noticed too that you seem to be, you've gotten quite a few of these HFMA certifications, right? And you've done quite a bit with them. How did you come across that?
Oh yeah. So I love to find resources that are affordable and accessible. As a student, you have a lot of perks like some discounted memberships. HFMA was great because you can sign up. It's a huge discount on their annual cost for membership as a student. You get access to all of their resources, textbooks, webinars, and certification exams. So this was a kind of way of stacking the odds in my favor so that I could be successful as an administrative fellow. I got a project management certification, business intelligence, operations excellence, quite a few. Uh, and it wasn't necessarily to have letters after my name. It was more so that I could kind of reinforce what I learned in my MHA and show that I'm preparing myself to hit the ground running once I started my fellowship.
And would you recommend that to other potential fellows or students?
Absolutely. If anything, it just kind of helps you learn the business acumen to where you sound like you have a familiarity with the concepts and things that you come across as an administrative fellow or as an entry level healthcare administrator. Project management certification was very useful in terms of how to organize, run a project, manage communications, uh, and meet schedule, limit scope, uh, and to measure your performance and success. And then the business intelligence and financial management certifications were really great in just how to kind of explore data, learning about data sources, how to prepare data, how to analyze data, and how to structure results in such a way that you can communicate that to various stakeholders.
No, absolutely. Nice. Thank you for that recommendation because a lot of people are looking for those resources as well. And so whenever I see it on somebody's resume, I want to ask about it. And I also noticed you've been involved in a few different various volunteer opportunities as well. And I wanted to ask, do you have any advice on how to manage your time across the volunteering, the education, the work? I mean, a lot of these things you've done all at once, looking at the resume. And so any advice on how you've been able to manage your time?
Yeah, definitely. So time is an interesting thing. I think of it kind of like a portfolio. and your priorities are reflected in how you allocate your time. I choose to invest my time in things that give back to the community, but also give back to me and kind of help fill my cup. A lot of people think long hours or working on multiple things is the main contributor to burnout. There's something to be said about that, but then there's also something to say about the fulfillment you get from doing things outside of work, like volunteering, uh, that really kind of help you fulfilled, even though they are a time constraint. They kind of energize you to get back to what's important at work. So balancing family is also important. Uh, no one, I think, at the end of their life ever says, "I wish I would have worked more. I wish I would have studied more." So it's just trying to triage your priorities, balance them to where you're allocating them to what you feel like is most important, and then trying to find ways to fill your cup so that you can keep going.
Nice. Yeah, thank you for sharing that too. That family is. I agree with that very much myself. Right. It's so important to put, I think, family first. And I wanted to ask, how does HOPCo deal with that? Are they, good about work life balance there? Do you feel like it's been, a good experience in terms of that?
Yeah. So that's an interesting question. Uh, there's a couple different ways I want to approach this question. First and foremost, I will say that a lot of people around me work some long hours. The managers and the directors, they put in work. I see them on teams or in a operations PBIX, like a file used to manage data for a different service line, uh, at all hours of time. And so there is this kind of pressure for me to put in those long hours because I want to show that I'm part of the team. Uh, but no one's ever asked me to stay late or to come in early. In fact, they've never pressured me to be even in the door at 8 a.m. or to be out, you know, after 5. Everything that I've done outside of my normal work hours is because I just felt like it was important and was motivated to do so. That being said, HOPCo has allowed me the flexibility to put family first in ways that I never anticipated. I just found out about a month ago that I'm going to be a father for the first time.
Oh, congratulations. That
Super
is
excited.
amazing.
Yeah, super excited. And when HOPCo found out, they actually offered me the opportunity to go back home to my wife and work remotely, so that I could support her during her pregnancy and still complete my fellowship without the distraction of worrying about what's going on back at home. So landing this fellowship is probably the best thing I could have ever asked for. Uh, in that fellowship hunt, you kind of have your top choices and the places you think are the best fit for you. I'll be honest with you, I had put other places higher, and I'm so grateful that I ended up where I am now. We don't always know what's best for us, so things work out, and this fellowship has afforded me the opportunity to advance my career and then support my family in ways that I wouldn't have thought possible.
That is awesome. And that's what I wanted to ask about too. It's a different type of fellowship than what maybe a lot of people are originally thinking of when they're looking for a fellowship. And so can you just help us understand, what HOPCo is, what they do, and then how it differs from, the traditional hospital operations fellowship?
Absolutely. So HOPCO is an MSK value-based care company, the largest in the U.S. We do everything across the MHA space in terms of business development, service line management or practice management, and analytics. And as a fellow, you are in a project based role as opposed to rotational. Project based meaning you work on projects throughout. You don't necessarily filter through different departments or service lines or health partners. It's good for someone who kind of has an idea of what area of focus they want to be in, or someone who's probably a little familiar with healthcare, as opposed to someone who wants to get exposure to different departments. And the way the project selection works is at the start of your fellowship, you're introduced to every executive leader, you're introduced to the directors of every partner we have, and you're given an overview of all the different service lines that we have. And meetings are added to your calendar. They're the routine, reoccurring meetings for each of these service lines. And as you kind of attend these meetings, there'll be opportunities to say, hey, I see you need help with this or you're working on this. I think this is something I could support you in. So it's very, very exciting to be able to just jump in and say, this is what I'm interested in, and then select projects based on that. Um, it, how do I say this? It, you kind of prune your interest, and the meetings kind of slow down gradually over time. You kind of stop attending all the meetings and just focus on the meetings that are directly related to what you're interested in and what you're focused on in terms of projects. So you very much guide your fellowship experience, and you very much guide the selection of what you work on.
Nice. And I appreciate that saying that because, some fellowships are very general and you do that rotation based from department to department, or you do a project in every department. But I like how here it allows you to have that option as well. If you have a little bit more experience in healthcare, or you're coming out of your internship knowing a little bit more about what you want to do, and then you can narrow that down. And so I have to ask, what area have you been narrowing it down to? What are some of your areas of passion?
Yeah. So I like quality, operations, and finance. A lot of what I'm working on are all very much rooted in those things. I also like being exposed to data analysis and analytics. Uh, my goal is maybe not to understand in depth, Power BI, but to be able to use tools like that to ask important questions, to identify areas of opportunity, and to figure out ways we can do things a little better, or maybe see how one partner does something well and how another partner also is able to do it well, and kind of compare and contrast the different approaches to solving a problem.
What do you like about the quality area, that interests you?
The quality area I feel like is kind of directly related to my background. Uh, we're an MSK focused company. We do orthopedics, ambulatory surgery centers, orthopedic practices, therapy clinics. So it very much aligns with what my experience was as a clinician, and kind of being able to use that background and perspective in combination with like evidence to and data to kind of drive performance improvement and to deliver better care to the patients. It's one of the areas that I feel like everything you do directly impacts or changes the way someone provides care or receives care, which is very fulfilling.
Do you think that having been a clinician has helped you or benefited you as an administrator?
Sure. Uh, just because I'm familiar with hospitals, I'm familiar with therapy clinics, I'm used to interacting with physicians or nurses, uh, different stakeholders in the healthcare arena. So it definitely supports it, but it's certainly not a requirement. It helps to be familiar with healthcare. I would think anyone in a healthcare administration degree program or an MBA program with a healthcare concentration probably has a similar experience, but it certainly helps to be familiar with healthcare before starting a fellowship.
Nice. Yep. No, I agree. I think that it can give you a little bit of a boost, right? Kind of where you know some of the terminology a bit easier, especially in MSK, because that's. I mean, I'm assuming it's fairly related to what you had done in terms of a lot of the terminology.
Absolutely. I think whenever you're selecting a fellowship, you need to choose what aligns with where you're at currently and where you want to be. And so for me, this fellowship aligned perfectly with my previous experience and aligned perfectly for my vision for where I want it to be in the future.
Nice. So I want to talk real quick about Phoenix, Arizona, right? So that's where it's based out of. You're of course a Southerner. You're from the general South area. But what are your impressions of Phoenix? How are you dealing with the weather? What is the apartment rental market like? What's that looking like for you?
So Phoenix is hot. I think this year we had over 100 days in a row over 100 degrees. We recently broke that snap, but there's definitely some heat. Every time I step outside of my apartment, it feels like I'm kind of walking in front of a hair dryer. Uh, so that is a little tough to deal with. But that being said, there's a huge diverse community in Phoenix, a thriving kind of downtown area and suburbs of Phoenix. So there's tons to do, tons to explore. If you ever want to get out the house, there's plenty of opportunities, even for things that are outside of the heat. And then there are several lakes and different kind of outdoor things that you can use to cool off. Uh, so there's never a moment where you're going to run out of things to do, especially in the year-long period that you're a fellow.
Nice. That's awesome. And then, what is the future looking like for you? What are your plans. You have about 8 months left into the fellowship, right? So I mean, that's a little ways to go. You have a lot to learn still, but what are you most looking forward to, and what are your plans?
Yeah, so that's an interesting question. I I'm really excited to see where this fellowship takes me. I've been able to network with tons of different people in my area, in Phoenix, across the country. Every health system I work with, I'm on a first name basis with a lot of healthcare administrators in Florida, in North Carolina. Um, so I'm excited to see where things land. I am not really particularly fond of mapping out specifically where I want to be. I don't really want to pigeonhole myself into one position, but I would love to expand on my ability to perform data analysis, work with different stakeholders to improve their service lines, and to guide providers to kind of giving the best care that they can to patients. And so that's what I hope to be doing more of in the next few years.
Why do you think it's a good idea not to, like you said, pigeonhole yourself, not to lock yourself into one thing? I mean, you have experience in changing your career path. So, for younger ones, maybe who are in undergrad, any recommendations on why it's not a good idea to do that?
Sure. Healthcare is dynamic. Things change, and we have a lot of disruptive forces influencing healthcare right now, right? We got AI, we have all these analytics platforms. There's so many changes taking place that I like the idea of being open to opportunity where it presents itself and accepting the idea that maybe what you think for yourself is good, but it may not be the best fit for you when push comes to shove. Uh, I thought, I would be at a hospital doing a fellowship, and that was where I wanted to be. And when I got rejected from the first hospital fellowship that I applied to, I was a little disgruntled, a little disappointed. Rejection happens, and sometimes it's a tough pill to swallow. But I'm grateful. I'm so grateful that it happened because I am where I am now. And I just have faith that things are going to work out as they're intended to. So I like to keep my options open and to kind of just see where my experience and abilities and network take me.
Yeah, that's excellent advice, though. I really do appreciate it. I appreciate you coming on, Caleb, and sharing kind of your journey with us throughout your career, as well as giving some really important advice and tips. And letting us take a look at HOPCo too. I mean, it's a great organization. It's a very unique and exciting organization. I think most of the previous fellows there I've interacted with at some point, and they're all very incredible. So, really appreciate your time coming on, and I hope that we can have you on again when you get your post fellowship role.
There we go. I'm excited for it. We'll see where things go. If past performance is indicative of future success over the last 5 years, 9 out of 10 fellows have been hired on, and the one fellow who didn't continue working with HOPCo landed a job before the end of his fellowship. So I'm excited to see where things land and excited to see what the future holds, and would love to talk with you again.